Who's at risk of having low magnesium? Turns out the majority of us. Here are 7 reasons why. What does a flammable metal that's used in laptops, cars, and even napalm have to do with the heart, diabetes, or pregnancy? Magnesium, the 4th most common element on planet Earth, is also the 4th most abundant essential mineral in the body. And on a microscopic level, cells depend on magnesium for things like making DNA or proper function of mitochondria, the power plants of our cells. But it's also involved in different medical conditions that affect the heart and the brain. It's been linked to diabetes, and it's even a crucial treatment for certain pregnancy complications. I'm Zane, a board-certified primary care doctor, and in this video we'll go over 7 causes of magnesium deficiency, including the #1 cause in the United States. But first, we'll talk about what magnesium actually does in the body and what happens when it's too low. Magnesium's effects on the body lie on kind of a spectrum. In general, it has a calming and slowing effect. When people have too much magnesium in their body, it can slow the heart rate and breathing, make people sleepy, and even cause death in rare cases. On the opposite end of the spectrum, low levels of magnesium in the body, which is much more common, can lead to hyperactivity of different organs like rapid and sometimes fatal heart rhythms, as well as something called neuromuscular hyperexcitability in the brain and the nervous system, which, as the name suggests, makes neurons more likely to fire. This causes things like muscle spasms, overactive reflexes, and chronic pain in the body, and insomnia and mood changes in the brain. In some cases, if mag levels fall low enough, it leads to such extreme hyperexcitability in the brain that it causes seizures, which are kind of like electrical storms of neurons firing. On that note, magnesium plays a huge role in the nervous system, and it's pretty interesting. The body actively works to pump magnesium from the blood into the cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. There's a good reason why. Magnesium is a cofactor for hundreds of enzymes, which basically means that a lot of the biochemical reactions in our body need magnesium to happen, and a lot of them are very important for the nervous system. Magnesium's essential for enzymes and cell membranes to function properly, and when they don't, things like tremors, muscle twitching, vertigo, and seizures can happen. Psychologically, low magnesium can manifest as depressed or anxious moods. In the lungs, magnesium deficiency can worsen asthma because the muscles around the airways squeeze shut during asthma attacks, similar to how magnesium deficiency makes muscles twitch and cramp up, and infusions of magnesium are sometimes used in the hospital as additional asthma treatment. In some people, low magnesium may be involved in the development of chronic pain, headaches, fatigue, insomnia, anxiety, depression, and fibromyalgia, which is a disease that can involve all of these symptoms. For migraine headaches specifically, magnesium deficiency is related to the release of certain neurotransmitters and constriction of blood vessels, 2 factors that promote headaches. The American Academy of Neurology concluded that magnesium therapy is probably effective for migraine prevention, but this should be done under the guidance of a healthcare provider. Not getting enough magnesium in the diet can lead to insomnia, but can magnesium supplements help you sleep? There isn't a lot of great evidence at the time of this video that proves magnesium supplementation can treat insomnia in people with normal levels, but because it's low risk for most people when taken in limited amounts, it might be worth asking a healthcare provider about taking a supplement for sleep. Magnesium has been linked to neurotransmitters or brain chemicals like noradrenaline, dopamine, and serotonin, the happy chemical that improves anxiety and depression. People with low serotonin levels are also more likely to have low magnesium levels. When added to other forms of treatment by a healthcare provider, magnesium intake might help depression. Interaction between stress and magnesium goes both ways though. Stressful emotional states and activities can lead to lower magnesium levels too. Maintaining healthy levels of magnesium can protect the body against emotional and physical stress by reducing the production of stress hormones and the body's response to them. But over time, low magnesium is linked to reactive oxygen species, oxidative stress, and inflammation. People with diabetes tend to have higher levels of inflammation and lower levels of magnesium, and as we're seeing, low mag levels are common in a few different conditions. Magnesium helps suppress excitability and overactivity in nerves, muscles, and the heart, but at the same time, it's necessary for managing energy inside the body at multiple levels. It helps process blood sugar and supports energy production in the mitochondria inside cells. And magnesium helps maintain insulin sensitivity, the body's ability to extract glucose out of the blood effectively. When this starts to fail, diabetes happens, which is when too much glucose hangs around the bloodstream and causes health conditions like cardiovascular disease. As to whether or not magnesium supplements can help though, there are some studies out there that suggest that they can help diabetes, but more research needs to be done. Regardless of whether supplements help, diets that contain more magnesium, like ones that we'll talk about here in a second, are a great place to start because they're associated with lower risk of diabetes among other health benefits like better heart health. We know magnesium is related to the heart, but to what extent? Really low magnesium can cause torsade de pointe, and I'm sure I'm butchering the name, but it's a fatal irregular heart rhythm that's treated directly with magnesium. Over time though, magnesium that's low but not low enough to cause an arrhythmia can still affect our long-term heart health. There are some claims that taking magnesium can improve blood pressure, but is it true? The DASH diet, which I talk about in another one of my videos that I'll link to down below, provides a lot of magnesium through lots of fruits and vegetables, and it's been shown to lower blood pressure. It also includes potassium and calcium, both of which are also associated with better blood pressure, so it's hard to tell exactly how much magnesium directly contributes to blood pressure improvement. More and higher quality research is needed to really determine if and what forms of magnesium can improve blood pressure. At the end of the day though, we know that the DASH diet and the Mediterranean diet can help you live longer, and a lot of that has to do with the large amounts of vitamins and minerals they contain. In 2022, the FDA let companies claim that magnesium-containing foods and supplements might reduce blood pressure, but only if they contain above a certain amount of it, and they have to say that the evidence is inconsistent and inconclusive. Part of that might be because diets high in magnesium also have a lot of other heart-healthy nutrients, and foods rich in magnesium like nuts and beans are often lower in salt and high in fiber, which we know can help blood pressure too. And in reality, too much sodium probably affects blood pressure more than low levels of magnesium does. I talk more about this in one of my other videos I'll link to. Low magnesium levels have been linked to strokes and coronary artery disease, both caused by clogged arteries in the brain and the heart respectively. It's possible that magnesium helps blood vessels from narrowing and becoming blocked. Along with the vast amounts of research on the DASH and Mediterranean diets, research suggests that getting enough magnesium through fruits and vegetables is an excellent way of helping to prevent cardiovascular disease, partly through improving blood pressure, lowering inflammation, and improving risk factors like diabetes and excess weight. Magnesium helps manage potassium and calcium levels in the body, and really low levels of magnesium can cause low levels of the other two electrolytes as well. That's interesting because all three are related to heart, muscle, and bone health, and they're all found together in healthy diets as well. And all three are next to each other on the periodic table. Coincidence? In pregnancy, infusions of magnesium into the bloodstream are used to prevent eclampsia, a potentially fatal condition that can cause seizures and dysfunction of other organs. Now that we know what magnesium does in the body and what happens when it's low, who's at risk of having low magnesium? Turns out the majority of us. Here are 7 reasons why. The most common cause of low magnesium is not getting enough magnesium through the diet. Dietary magnesium deficiency may be one of the most under-recognized conditions in modern times. Here in the United States, more than 2/3 of American adults don't get enough magnesium in the diet, and about 1/5 of people get less than half the recommended daily allowance of magnesium. Why? The mineral content of magnesium in food sources is declining, and a lot of it has to do with the increased amounts of processed and refined foods. So eating diets like the DASH and Mediterranean diets high in fruits and vegetables can help people get the recommended amounts of magnesium and other vitamins and minerals. There are also certain groups of people who are even more prone to magnesium deficiency, like these next 6. Magnesium intake is related to total calorie intake, so people like athletes who tend to eat a lot more calories rarely have magnesium deficiencies. Women, however, are statistically more likely to have low magnesium. In older adults, metabolism changes with age, but a large part of why they're low in magnesium is because they're more likely to consume less calories than younger people. Older adults consume less calories partly because of things like having less of an appetite, less interest in food because of loss of taste and smell, difficulty with dentures, and trouble shopping for and preparing meals. It's not a bad idea to check in with any older adults in your life for these barriers to proper nutrition and intervene if necessary. You never know, you might change someone's life with a phone call or a home visit. We know diabetes is associated with low magnesium. Part of that might be related to low amounts in the diet. But complications of diabetes can cause the body to get rid of magnesium as well. When blood sugar stays too high, the kidneys try to get rid of it by producing more urine, which carries away extra sugar, but magnesium goes along with it, lowering the overall level in the body. Diseases that make it hard for people to absorb nutrients in the GI tract, like Crohn's disease or celiac disease, can lead to low levels of vitamins and minerals, one of which can be magnesium. A lot of important life-saving drugs like diuretics, antibiotics, and proton pump inhibitors or PPIs can lead to low magnesium. PPIs like Nexium or Prevacid are a class of medications that are necessary for certain gastrointestinal conditions, but when taken consistently for long periods of time, typically for over a year, they can cause low magnesium levels by interfering with the absorption of magnesium. In about a quarter of people, taking a magnesium supplement doesn't improve their levels and they have to stop the PPI medicine altogether. That's one of the reasons why people who are on PPIs long-term should see a doctor, both to discuss checking magnesium levels and to investigate what's happening in their body that's making them need this medicine for so long in the first place. Oh, and pro tip, If the generic name of the drug ends in prazole, it's probably a proton pump inhibitor. While diseases involving the GI tract can cause low mag levels, magnesium is actually used to treat GI symptoms like upset stomach and constipation, and it's one of the main ingredients in over-the-counter medicines like Maalox, milk of magnesia, and magnesium citrate. Over-the-counter medicines like these are actually a huge cause of magnesium toxicity, but it's more common to have low levels from the causes in this video than to have too much. Calcium is regulated through vitamin D, a crucial vitamin necessary for bone health and immune function. With the close relationship between magnesium and calcium, it makes sense that low vitamin D can lead to low magnesium levels as well. Excess alcohol intake both reduces the amount and nutritional quality of food, which as we know can cause magnesium deficiency. But it also causes diarrhea and affects how the kidneys process magnesium, which further deplete the body of magnesium. If any of these sound like you, or you have concerns about your magnesium levels, be sure to check in with a healthcare provider. A good place to start is by eating a healthy diet, something that I talk about in this video over here. And if you found this video helpful, you might like this one too. Peace, and see you in the next one.